My name is Libby Rates. I'm Chief Nursing Officer at St. Elizabeth Regional Medical Center. The Health Hub is actually a communication hub for patients to find a medical home. And it came to be as a result of the Mayor's Task Force that was put together in 2009. The community convened, and actually it was through the efforts of a grant that we received from Catholic Health Initiatives, their mission and ministry funds. So that they afforded us the opportunity to bring community partners together to talk specifically about medical access for the underserved in our community. One of those recommendations was the creation of this Health Hub. And that is actually what it's called, the Hub. We have patient advocates manning phones, and they get referred by community agencies, but the intent is to help them find a medical home. Then we want them to have a doctor that will take care of them or a medical home. And what this affords the hospital, the gravy to all this, is that we've seen a dramatic reduction in people using the emergency department, the most expensive place in the hospital, to receive their basic health care. I believe it's the right thing to do. It aligns with our mission. In the end, the hospital has realized a savings or a cost avoidance. We have story after story where people have enriched their lives, they're taking their medications. That's just one example of some of the success stories we've seen through this program.
I'm Jeanette Wadalevich. I'm the Chief Financial Officer for CHI Nebraska. As a finance person looking for access, I was worried about the dollars and cents, but I was just significantly amazed at the resources really that we have in Lincoln for the underserved. Part of my role was just simply to provide the perspective of the hospital executive or the hospital in this committee. But what I learned were there's over 49 agencies and access points within Lincoln to provide care for the underserved. And what was the aha for me was, we've got all these resources. I knew about just a couple of them, yet we've got this fragmentation. So part of my role was, I think, being able to voice that in a way that said, we need somebody to collate and bring all these resources together, like a hub and spoke concept. All these resources, and we need a hub to bring them together. And that really became then the impetus for the Health Hub that was created. From the beginning of the testing, over 500 calls were coming in to this hub. Well, within a year now, that's up to over 800 calls per month. One place to call to collate and get access to all these different resources. It's just been amazing. When you look at the fact that we're getting the right access, the right services to people, living our mission every day, we've seen over $2 million of savings to this community by the fact that we're actually getting the people, the patients, to the resources that they need, rather than them falling to the hospitals or more expensive resources for their care. Our situation in Lincoln isn't any different, I can't imagine, than others. A lot of opportunity, a lot of services available, very difficult to navigate. So with a limited amount of funds and a lot of community support, I believe any community could use this as a model for their services.